By this weekend, Kathy, there'll be more than 7 million people across the north of England living under Tier 3 restrictions. The Prime Minister says that it is about targeted action to avoid what he calls the misery of a national lockdown. That is not much comfort to people who are here. And this evening, we can reveal figures that show the inequality of COVID being felt in the north and not just in terms of economics. There's a truth we learned from the first wave of this pandemic. The virus does discriminate. And now figures seen by this programme reveal another inequality of COVID-19. In the north of England, the death rate is significantly higher.
She was the love of my life. She was my soulmate. She was everything to me. And I've lost all that.
In May, Jane's wife Julie died in hospital in Hull. Since then, she's joined with other families to campaign for a public inquiry into the deaths of their loved ones, but also for lessons from the first wave to be acted on now.
I'd hate anybody to be living the life I'm living at the moment, where I daily, continuously relive the death of my wife, how she died, what a terrible death she had. And it's starting all over again. It's like a nightmare on repeat.
In the early days of lockdown, cases and concerns were focused around London. But data analysed by a leading health expert in Manchester and seen by Channel 4 News shows even then there was a disproportionate impact in the north.
Excess mortality, deaths from COVID, and almost any other measure that you care to choose has worsened during the pandemic. And the reason that I was concerned about this back in March is the pre-existing health inequalities between the north and the south. COVID picks out the most vulnerable patients. We have a greater number of those in the north.
The data from the first wave shows a COVID mortality rate of almost 100 per 100,000 in the north of England, 14% higher than the rest of England. The gap is almost as big when non-COVID deaths are added in. All-cause mortality in the north at a rate of almost 500 per 100,000. Academics say even with deprivation, ethnicity and population age structure taken into account, the gap between north and south is significant.
I think if we don't get the current response right, my worry is that the economic recovery in the north will be slower, longer and harder. That doesn't have to be the case.
According to Professor Graham Lord, the health of the north and the economics of the north are inseparable. And his warning comes as more parts of the north are about to join Tier 3, with tighter restrictions and some businesses forced to close.
I really think the Prime Minister's crossed a Rubicon here, not just with the miserly way that he's treated Greater Manchester, but the grub it, take it or leave it way these local deals are being done. It's corrosive to public trust, to pit region against region, mayor against mayor, council against council, asking them to trade away their businesses and jobs.
Mr. Speaker, I'm proud of the support that we've given, the One Nation Conservative support that we've given to the entire country. £200 billion in support for jobs and livelihoods across the whole of the country already. A further £9.9 billion now for the Job Support Scheme.
But Tier 3 furlough is not the same as lockdown furlough. How the argued over 60 million for Greater Manchester will be allocated still isn't clear. And despite a legal challenge against the closure of many pubs and bars, they are still due to close on Friday night.
So are we going to live in this world of hokey-cokey where we're in, out of lockdown? We just don't know. So for now, we have a plan of where we can support our team for a certain number of months, but beyond that...
In many ways, for many millions of people, it is vital that the lessons of last time aren't wasted.